For the third night this week, your baby, who typically sleeps through the night, has woken you up. You thought your child had passed this phase. Try not to get frustrated, as what she might be experiencing is sleep regression, which is completely normal and will pass eventually. Keep watching because we're going to talk about newborn sleep, sleep regression, and parenting advice. How are infants supposed to sleep? Babies spend a lot of time napping. They normally sleep 14 to 17 hours each day, divided between daytime and nighttime naps. A baby's sleep pattern changes during the first year of life. These changes impact the length of sleep intervals during the day and night, and the number of hours spent sleeping. As your infant gets older, napping time will shorten. What is sleep regression? It's a 2 to 4 week phase in which a baby who has previously slept well begins to have difficulty going to sleep or wakes up crying during the night. What causes sleep regression? Some studies show that this sleeplessness may be due to developmental changes that occur in the first few years of a child's life. Babies typically lack a fully developed circadian rhythm, so as infants start to develop their circadian cycles, their sleep patterns may drastically change. This might vary from having more prolonged stretches of sleep to waking up frequently during the day. One study shows that periods of changing behavioral patterns and sleep patterns frequently overlap. Some studies also show that for babies between the age of 2 and 21 months, sleep regression may coexist with changes in the developing brain. These changes could be a growth spurt, increasing newborn's hunger, achieving a developmental goal, or teething. What are the signs of sleep regression? If your little one experiences sleep regression, you may notice a deviation from the regular sleep cycle, difficulty falling asleep, and regular nighttime awakenings accompanied by fussing and crying. The average duration of these symptoms is 2 to 4 weeks. Your baby's sleep pattern will often stabilize after this time frame. Stay tuned because we'll be giving you tips on how to manage little Junior's sleep. At what age does a baby experience sleep regression? The timing and length of sleep regression can vary. However, according to most specialists, regressions most frequently occur during a certain stage due to rapid growth, reaching new developmental milestones, or teething, as we mentioned earlier. We'll be delving into these sleep regression ages. 3 to 4 month sleep regression. The dreaded 4-month sleep regression is usually the most difficult for parents. Most babies typically sleep for fewer hours after this regression has been resolved. The 4-month sleep regression serves as a transitional stage for infants into a more developed sleeping routine. 6-month sleep regression. Babies at this age typically wake up several times during the night because they are hungry and need to replenish the energy they used while playing during the day. 8 to 10-month sleep regression. Separation anxiety is quite common and very acceptable at this age. Because of this, your baby can wake up in the middle of the night to secure your assurance. 12-month to 18-month sleep regression. When your bambino is between 9 and 12 months old, she will start to stand up and possibly start to walk. These important milestones may briefly disrupt your baby's sleep. Sleep regression after 18 months is typically caused by infants developing an adult-like circadian rhythm. 2-year sleep regression. In most situations, the 2-year sleep regression is the last episode. Regression in sleep quality at this time could be brought on by returning separation anxiety, brought on by changes in a child's environment, such as switching to a toddler bed or starting potty training. Having a severe fear of the dark could also be a cause. What tips can help you manage sleep regression in your child? The good news is that sleep regression is transient. After a few weeks, newborns usually resume their regular sleeping patterns. There are a few things that could help you prepare for these situations and enhance your baby's sleep. Feeding your baby enough during the day will prevent nighttime hunger pangs. You can begin sleep training if your child is at least 4 to 6 months old. The technique of graduated extinction sleep training is sanctioned by the American Academy of Pediatrics. This approach allows you to gradually prolong the hours your child sleeps. Also, know your baby's sleep cues. You should watch your baby's sleep cues, such as wiping the eyes, being fussy, and yawning. Creating a friendly sleep environment will also be beneficial. Before your little one goes to bed, cut down on the amount of time they spend watching TV and playing with their toys. Instead, try soothing them to sleep by reading a book or singing lullabies. A few thoughts to remember. It's temporary to experience sleep regression. You should make an appointment with your pediatrician right away if your baby's sleep issues don't subside after a few weeks. Help is available.